I woke up in the recovery room, confused, disoriented. A nurse was standing over me. "You're okay," she said. "Everything's fine now." But her face said something different. I tried to speak. My throat hurt. "Breathing tube," she explained. "What happened?" I managed to ask. "The doctor will talk to you. Just rest." Let me back up. I'd gone in for knee surgery. Torn meniscus. Simple arthroscopic procedure. 35 minutes, they said. In and out. I'm 29 years old. Healthy. No medical issues. This was supposed to be routine. I'd met the surgeon 2 weeks earlier. Dr. Patterson. Good reputation. Hundreds of these procedures. The morning of surgery, I arrived at 6 a.m. Pre-op check-in. Vitals. IV placed. The anesthesiologist came to introduce himself. Dr. Marcus Chen, mid-40s. Seemed professional. Asked standard questions. Allergies. Previous surgeries. Medical history. He explained what he'd be doing. General anesthesia. I'd be completely unconscious. He'd monitor my vitals throughout. Heart rate, blood pressure, oxygen levels. "You'll be safe," he said. "This is what I do every day." I trusted him. They wheeled me into the operating room at 8:30. Bright lights. Cold. Medical equipment everywhere. Dr. Chen stood at the head of the operating table. "Count backward from 10, he said. I got to 7. Then nothing. What I didn't know, 8 minutes into the procedure, my heart stopped. My blood pressure crashed. I stopped breathing. The monitors started screaming. Code blue.
I learned all this later, from medical records, from depositions, from the investigation. Because when I woke up in recovery, no one told me what happened. The surgeon visited me an hour later, Dr. Patterson. He looked exhausted. "Your surgery went well," he said. "The meniscus is repaired. You'll be fine." "What happened during surgery?" I asked. "The nurse said something went wrong." He hesitated. "You had a reaction to anesthesia. It happens sometimes. We managed it. You're stable now." "A reaction? To what?" "Sometimes patients react unexpectedly to the anesthetic drugs. It's rare but manageable." "Did my heart stop? Someone mentioned code blue." "Your vitals dropped temporarily, but we brought you back quickly. No lasting damage." He was lying. Not about the outcome. I was fine medically, but about what caused it. I went home that afternoon. Knee hurt, but that was expected. What wasn't expected, the hospital administrator called me the next day, asked how I was feeling, said they wanted to schedule a follow-up meeting. "Just routine," she said. "After any surgical complication, we like to check in." "Complication?" "The anesthesia reaction. We want to make sure you're recovering well." Something felt wrong. I talked to a lawyer friend. She said hospitals don't usually make follow-up calls like this unless something serious happened. "Get your medical records," she said, "before that meeting." I requested them. Took 2 weeks to arrive. When I read them, my blood went cold. Code blue called at 8:38 a.m. Cardiac arrest. Resuscitation performed. Epinephrine administered. 3 minutes of CPR. Heart restarted at 8:41 a.m. 3 minutes. I'd been dead for 3 minutes. The report said anesthesia complication, but it didn't explain what caused it. No drug reaction noted. No patient factors identified. Just complication. I hired a medical malpractice lawyer. She reviewed the records. "This doesn't make sense," she said. "You're young, healthy, no risk factors. Hearts don't just stop during routine procedures without cause." I filed a request for more documentation, incident reports, staff statements, operating room logs. The hospital resisted, said everything relevant was already provided. My lawyer pushed harder. Eventually, we got internal incident reports. That's when the truth started coming out.
The incident report was damning, written by one of the surgical nurses. Patient experienced cardiac arrest at approximately 0838 hours. Anesthesiologist Dr. Chen was slow to respond, appeared confused, did not immediately adjust medication or assist with resuscitation. Surgical team initiated code blue. Dr. Patterson began chest compressions. Dr. Chen eventually administered epinephrine after repeated prompting from nursing staff. Slow to respond, appeared confused, did not immediately assist. My anesthesiologist, the person whose job was keeping me alive, had been impaired. My lawyer dug deeper, requested Dr. Chen's employment file, requested any complaints or incidents involving him. The hospital fought every request. It took 3 months and a court order. Finally, we got the documents. Dr. Chen had been under investigation for 2 months before my surgery. 3 nurses had filed complaints, said he appeared impaired during procedures, glazed eyes, slow responses, confusion. One incident report from 6 weeks before my surgery. Patient's oxygen levels dropped dangerously. Dr. Chen didn't notice for 90 seconds. Nurse had to alert him. Another incident. Dr. Chen documented administering medication to a patient who hadn't received it. Medication logs didn't match his records.
The hospital had opened an internal review, but Dr. Chen was still working, still putting patients under anesthesia, still responsible for keeping people alive. Then, my lawyer uncovered something worse: drug inventory discrepancies. Fentanyl missing from the anesthesia supply. Small amounts, but consistent. A pattern going back 5 months. The pharmacy had flagged it, sent reports to administration. Nothing was done. Dr. Chen was stealing fentanyl, using it himself and showing up to work impaired. My surgery happened on a Tuesday morning. Security footage from the hospital parking lot showed Dr. Chen arriving at 7:15 a.m., sitting in his car for 8 minutes, then entering the building. My lawyer had the footage analyzed. Classic behavior, the expert said. Sitting in the car before work, likely using. We requested toxicology reports. Dr. Chen hadn't been tested that day. Hospital policy required drug testing only if someone requested it. No one requested it, even after my code blue, even with 3 prior complaints about impairment. No one tested him. The cover-up was institutional. My lawsuit uncovered 6 other patients. 6 other people Dr. Chen had endangered while impaired. One woman, age 47, gallbladder surgery, blood pressure crashed. She survived but suffered a stroke from oxygen deprivation, now has permanent cognitive impairment. One man, age 61, hip replacement, heart stopped for 4 minutes, brain damage, requires full-time care. One woman, age 34, C-section delivery, dangerous drop in blood pressure. Baby delivered safely, but she hemorrhaged, nearly died. 4 others with complications that shouldn't have happened, all within 6 months, all with Dr. Chen as anesthesiologist. The hospital knew
They had complaints, they had inventory discrepancies, they had incident reports, and they did nothing. Because Dr. Chen was valuable, experienced anesthesiologist, hard to replace. They were short-staffed, so they looked the other way. Until people started dying. My lawsuit went public. Local news picked it up. Other victims came forward. The state medical board opened an investigation. Dr. Chen's license was suspended. He entered rehab, admitted to fentanyl addiction, said it started after a back injury 2 years earlier, prescribed pain medication, got addicted, prescription ended, started stealing from hospital supply. He said he didn't think he was impaired, thought he was managing it, didn't realize how dangerous he'd become. But the records showed otherwise. He'd been confronted by colleagues. 3 different doctors had expressed concerns to administration. He knew. The hospital knew. And they kept letting him work.
The settlement was $8 million, split among 7 victims. I received $1.2 million. The woman with brain damage from the hip replacement got $3 million. Her care costs will be millions more over her lifetime. Dr. Chen's medical license was revoked permanently. He can never practice medicine again. The hospital faced sanctions from the state, required to implement new drug testing policies, mandatory testing after any incident, random testing for all anesthesiologists, immediate suspension for suspected impairment. Policies that should have existed already. 3 administrators were fired: the chief of staff, the head of anesthesiology, the compliance director. All knew about the complaints. All failed to act. I'm okay now, physically. My knee healed. No lasting damage from the cardiac arrest. But mentally, it's different. I can't go into hospitals without anxiety. Can't trust that the person putting me under anesthesia is sober. Can't assume that institutions will protect patients over their own interests. Because mine didn't. They knew Dr. Chen was dangerous, and they let him keep working. Until my heart stopped. Until others were permanently damaged. Until they couldn't cover it up anymore. So here's my question for you. Should hospitals be required to drug test medical staff regularly? Should impairment complaints trigger immediate action? Should patient safety override staffing concerns? Because in my case, it didn't. My life was less important than avoiding difficult staffing decisions. And I'm one of the lucky ones. I survived. Others didn't escape so easily. Leave a comment. Share your experiences. If you've encountered medical negligence, speak up. Because silence protects institutions that fail their patients. Thank you for watching. If this story makes you think about patient safety, share it. Stay vigilant, ask questions, and remember that your life depends on the accountability systems that often fail. Because mine almost ended. Because my anesthesiologist was high, and no one stopped him.